So yes, thank you very much for that introduction, Justine. My name is Dan. I'm the Involvement and Engagement Manager for the local Clinical Research Network for the NCRN North East North Cumbria. So as Justine's mentioned, the purpose of today's session is to provide an overview of Research Champions and the Participant in Research Experience Survey, or PRES for short. Before we jump into Research Champions and PRES, I thought I'd first introduce the NIHR and the local clinical research networks, or the NCRNs. So the National Institute for Health Research, NIHR, was established by the Department of Health and Social Care in 2006 under the government's research strategy, Best Research for Best Health, with its mission to improve health and wealth for the nation through research. The NIHR plays a key role in the government's strategy for economic growth, attracting investments by life sciences industries through its world-class infrastructure and health research. Together, NIHR people, program, centers for excellence and systems present the world's most integrated health research system in the world. So the NIHR has 6 core work streams. These comprise funding high quality timely research that benefits the NHS, public health and social care. The NIHR is committed to funding health, public health and social care research that leads to improved outcomes for patients and the public and makes the health and social care system more efficient. We invest in world-class expertise, facilities and skilled delivery workforce to translate discoverables into improved treatments and services. The infrastructure, the NIHR provides support to research we fund and underpins research funded by others. Our investment has transformed the health system's ability to turn scientific discoveries into new or improved treatments and services. We partner with patients, service users, carers and communities, improving the relevance, quality and impact of our research. Research is shaped in collaboration with patients, service users and carers and communities. People contribute at every stage of the research pathway and also play a vital role in participating in studies and trials. We attract, train and support the best researchers to tackle complex health and social care challenges. The NIHR is the nation's largest funder of health and social care research training. We provide career pathways for clinical academics, non-clinical scientists, and offer opportunities for nurses, midwives, and allied health professionals to integrate research into clinical practice. We collaborate with other public funders, charities and industries to shape a cohesive, globally competitive research system. We work closely with partners from across the public sector, with medical research charities, life sciences industries. We aim to create an integrated system that meets the needs of the patients, the public, and positions the UK as a globally attractive destination for high quality clinical research. And we fund global health research and training to meet the needs of the poorest people in low and middle income countries. So working closely with the global health research community, the NIHR funds applied research and training for the benefit of the poorest people in more than 50 low to middle income countries. By sharing learning and knowledge, we're able to build R&D capacity and capability in both the UK and low and middle income countries. So now touching on clinical research networks, or CRNs. Clinical research networks support the NIHR and the clinical research infrastructure throughout England. They work towards increasing access for patients to new and better treatments in the NHS and social care. There are 15 CRNs across England, and these CRNs are overseen by the National Coordinating Centre that's based in both Leeds and London. So as you can see from the map there we are based right at the top, the North East North Cumbria. That's our CRN, or LCRN. So our LCRN aims to promote increased opportunity for people to take part in health and social research. It helps facilitate effective and efficient studies, their setup and delivery, and supports the government's strategy for UK life sciences by improving the environment and commercial contract research in health and social care settings. Our LCRN has a vision, and that is to improve health and care outcomes for the people of the North East and North Cumbria through research. We're hosted by Newcastle upon Tynes Hospitals Foundation Trust. We work collaboratively with all the NHS trusts in that area, primary care organisations and other qualified providers, and we make sure health and social care occupies the place it deserves in the day-to-day workings of the NHS, care homes and hospices. And we're increasingly supporting research into public health, for example, in local authorities, schools and other community settings. As mentioned, we work with all 11 trusts and 8 CCGs that constitute the North East North Cumbria patch. The NIHR clinical research networks provide researchers with the practical support they need to make clinical studies happen in both the NHS and in the wider health and social care environment. The CRN support research being delivered across 30 specialty therapy areas, which you can see listed here. These provide a network of research expertise and clinical leadership to deliver on these studies. Each specialty is made up of expert clinical leaders and practitioners who work both nationally and at local levels to ensure studies are delivered successfully and to promote awareness of research opportunities for participants to take part in. So as you see, it's a very varied list there, going from aging down to liver, to stroke, to surgery, to trauma and emergency. So I've provided a brief overview of the NIHR and the CRNs or LCRNs. I'll now move on to research champions. So what are research champions? So research champions volunteer their time to help the NIHR clinical research networks spread the word about health and care research to patients and the public, especially those groups who are currently less likely to take part in research. They also help research and healthcare staff understand more about the experience of those who take part in research. Through their important work, research champions help to promote research in health and care services and across the society more widely. Over the next couple of slides, I'll provide some information on the Research Champion Programme and then focus on the research champions themselves. So, research champions in terms of the programme and what it helps with. So it helps organisations work towards the national standards for public involvement. These will be discussed in previous presentations in this series, but I think it's important to reference them, and I will also touch on them a little bit more on the next slide. It helps in the delivery of the NIHR priorities as part of our contracted Department of Health and Social Care. It helps trusts and other partners deliver against their Quality Care Commission or CQC inspections for research activity and patient involvement. It helps the promotion of research to patients, again as measured by the CQC and patient survey. And it can help inform leadership and governance reviews within trusts and partner organisations for research activity as part of their well-led framework. And when referencing the well-led framework, this programme can help them go through the criteria and answer the questions the CQC may ask them. Great. So moving on to the national standards for public involvement. So I mentioned these in a previous slide. These were developed by the NIHR, Chief Science Office Scotland and Health and Care Research Wales. The UK standards for public involvement provide a clear, concise statement for effective public involvement, providing a framework for what good public involvement in research looks like. They are designed to encourage reflection and learning, including where lessons have been learned when public involvement has failed to lead to expected outcomes. You can learn as much, if not more, from your failures and your successes. They're to be used as a tool to help people and organisations identify what they're doing well and what needs improving. They're also intended to be used with any method or approach to public involvement in research. There are 6 standards. As mentioned, these have been discussed in previous sessions, so I'm not going to go into them in great detail, but they are inclusive opportunities, that's offering public involvement opportunities that are accessible and reach people and groups according to the research need. That communications use plain language and are well-timed and relevant communications as part of an involvement plan. That you offer and promote support and learning that builds confidence and skills for public involvement in research. That you seek to working together, that values all contributions and that builds and sustains mutual respect and productive relationships. That when it comes to governance, you involve the public in the research management, regulation, leadership and decision-making that can really help build public trust. And you also look at impact and you seek to improve by identifying and sharing the difference that public involvement makes to research. But as mentioned in the previous sessions, they're covered in more detail. And what I would mention is that within the previous sessions as well, they do also mention some soft skills and some soft standards that can go and accompany these. So I'd recommend having a look at them. So it's also important to understand where the programme and the research champions themselves can sit within the research cycle. So in its most basic format, the research cycle includes identifying the research topic. So that is where you consider what your research is going to be about and start to refine it. You look at designing the study. So once the researcher has identified what the research is about, they'll then need to consider the design study. The research topic will usually inform the design of the study, particularly if it concerns a theory that they'll be testing. You then move on to conducting the research. So once the research design has been chosen, the research will conduct the study. This will involve collecting data. Now, when it comes to data collecting, this can be either two methods. You're looking at both quantitative data and qualitative data. So quantitative data is research methods that usually involve collecting data through standardized measures that allow for collecting numerical data, such as questionnaires or psychometric tests. Qualitative data revolves on collecting rich non-numerical data. This can include researcher interviewing participants or conducting focus groups. From that, you go on to analyze results. So once the data has been collected, the researcher will need to understand the results by analyzing the data. Quantitative data will be analyzed through statistical methods to investigate relationships between variables and different groups. Qualitative data, which will involve the researcher interpreting non-numerical data, including text, and understanding the perceived reality of others. This can be done through various ways, such as transcribing audio, assigning codes, and then looking for common or overarching themes. Then you look into published results, which is probably the most critical stage. Publishing the findings is also known as dissemination. This can be done through various formats, such as publishing in peer reviews, journals, or presentations, at conferences, posters, oral presentations. It's also important to ensure that this part of publishing results also is shared with participants. So where do research champions fit in, and how can they benefit the research cycle? Well, they can have a significant impact or influence on most of these steps. For example, a research champion can help a researcher identify their topic through sharing lived experience. They can help inform the design, again, reflecting on their experiences, so you get the most valuable data. They can help you better understand how to recruit. They can help you conduct the research, or help you facilitate opportunities for you to engage with people. And when publishing results, research champions can really help you create appropriate material to share with participants. So looking at the research champion role, so I've talked a bit about the programme, what it can help achieve, and where it can support research as part of the research cycle. I'll now focus a bit more on the research champions themselves, and as part of this, I'll play a short video where 4 of our research champions have shared views of their role. We're also fortunate to have a couple of the research champions with us today. So what we'll offer as well is an opportunity to ask any questions at the end of this part of the presentation.
In my mind, a research champion is somebody who champions research.
A research champion is someone who spreads the word about research.
Somebody who's trying to promote research within the public, but also help researchers understand what the public actually need as well.
To help improve research and improve people accessing research and participating in research.
Because medical research and social care research benefits everybody. It benefits everybody, every member of society, whether you have medical conditions or you don't.
I was actually doing a project with a researcher with regards auditing the acute areas of the hospitals for dementia patients. And it was talked about then, the person who was actually doing the research asked me if I would like to become a research champion. And up until then, I hadn't even heard about it. So I actually looked into it myself and thought, yes, that's exactly what I want to do.
The role for me is I can give something back. I was a carer for someone who suffered a stroke, and as a consequence of that, I learned so much about stroke. I felt that I wanted to use that knowledge to help improve research and improve stroke care.
It was my friend Sandy who motivated me. She'd been involved with research for years, and when I stopped working due to my own health reasons, she started getting me involved with different things and asking if I wanted to participate in stuff.
I became a research champion because I was involved in a trial, and the outcome was absolutely huge for me because it saved my life. The treatment and the care I had was absolutely amazing, so I felt I wanted to give something back.
help them to look at their research and look in detail at how they intend to recruit people, identify potential problems that may come up, speak up for people who are underserved, help them with developing patient information sheets that can reach those groups.
It also helps the researcher, if they have research champions or PPI panel involved, is actually getting the money for the research, the funding.
Having patient involvement just pushes the researchers to make sure that there is a point to it at the end of the day, that it's going to be beneficial to the public and to society in general. We're trying to make life easier for all of us.
Well, I think that the public need to be made aware that research and developments in healthcare don't just come about because someone else does it. It's because everyone has the opportunity to take part. And it's only by people becoming involved that care will improve.
A lot of people, a lot of the public are under the impression that research is either taking medication or they might have to go through a particular procedure or whatever. And we try to help to dispel these fears and to actually explain what types of research there are.
As research champions, we can raise more awareness and get more people involved and get the right people involved in the research studies.
I've been involved with the stroke research programme in using resources to help researchers reach people suffering aphasia. So people with communication problems for whom the research would often be excluded because it was difficult to communicate with them.
We've also, when we've been in various situations, hospitals, supermarkets, we've handed out literature with reference to what clinical trials are.
I'm actually a member of the Durham County Carers, and I help promote within the groups and friends, family, etc., so that they understand what the research entails.
I do quite a few different things through the NIHR, so I'm on a funding committee now for the Research for Patient Benefit Northeastern applications, which is amazing and so interesting.
One of the other things that I've been involved in is reviewing literature from the PPI point of view, so that it is actually at a level that's understandable for the broader public.
I write for the NCFE website as well, so I'm trying to get more clients to write for and find different social care providers that I can write for. So I like doing stuff like that as well. Yeah, get me to speak to people or to write something. I'm quite happy.
And I think I don't know, because I believe in it. I just do it automatically. I mean, I was talking to a lady in the coffee shop the other day about it. It's just an automatic thing.
So great, and thank you very much to some of the research champions who helped in producing that video. So what I would go on to now is, so we've heard a bit from the research champions, and to build on what they've shared, who are research champions and what can they do? So they are volunteers, as they've described, and are individuals who contribute as a research champion, how and when they want to. Their contribution will be shaped around their interests and their skills and their time. Some commit to regular activities, while others may volunteer as opportunities arise. They're patients, carers, members of the public who've taken part in research, and those who haven't. They're passionate about getting people involved in research to help drive and develop better treatments for everybody. They talk to patients and the public about healthcare research, giving talks, hosting stands within communities, visiting health services, and especially go to those groups who are currently less likely to take part in research. They can help clinical staff and research staff understand more about the experience of those who take part in research. As such, they can help co-design materials to raise public awareness of health and care research, like posters and leaflets, and help collect general feedback about taking part in research from participants. And they can help just generally raise awareness amongst friends and family about research and being a champion, and how taking part in research can help everybody. When speaking to people, they can talk about the Be Part of Research website and that campaign. It's for the public groups and people more about research studies and how they can take part. And I'll mention this in a bit more detail in a couple of slides. They can promote the Joint Dementia Research website and the importance of dementia research to the public. They can visit health and care organisations to tell people about health and care research and encourage them to connect with local research teams. They can take part in local action and market National Clinical Trials Day and health awareness, such as promoting arthritis research during National Arthritis Week. Or they can speak to interested patient groups about healthcare research. And they can write about their own experiences of participating in research and care research in NHS blogs and other platforms. But as mentioned, research champions are volunteers, so how much they do is dependent on them. So I've introduced Research Champions Programme, and we've heard from some research champions themselves. Before moving on to some of the training support research champions receive, does anybody have any questions they'd like to ask some of the research champions or myself about what's been presented so far? So, supporting research champions. So everyone who becomes a research champion must complete a sign-up form and attend a short induction, covering some of the information we discussed just in the questions there. This will give them all the practical information they need to volunteer, and also show them where they can learn more about health and social care research if they want to. If they're especially interested in promoting dementia research, they'll also attend or need to attend a joint dementia research induction module. After the induction, they'll be able to join the NIHR Learn, which is the dedicated online community platform, which can let you connect to other research champions as well as access other online resources to support the role. They'll also be offered lots of other activities to support their development as a research champion, and also get access to regional forums to meet other research champions across the region. So I'm just going to go and give you a quick tour of some of the resources available to research champions, that being NIHR Learn, the research community space, Be Part of Research website, and online training. So NIHR Learn is our online learning management system, and it's a platform we use to deliver our accredited training programs. We offer a range of courses to develop knowledge of clinical research, and it will also help support you do the best of what you want to do. Our programs have been developed by national leaders from the clinical research field and are available to anybody directly employed by the NHS, UK universities, or other publicly funded organisations supporting clinical research. The courses can cover anything from an introduction to NIHR through to the consent process or even leadership development. The platform is also host to the Research Champions Community Space. So the Research Champions Community Space is an online space to support learning, networking, information, and ideas exchange for research champions. The space has been developed for and with the research champion community in mind. It offers useful information of being a research champion, how you get involved in supporting healthcare research. It provides free, updated learning resources with access to a lot of other relevant materials from a range of sources. It also provides discussion forums with other research champions, both locally and elsewhere, providing the opportunity to interact and exchange ideas and information across the region and further afield. Here's the landing platform, or the homepage you're met with when you first go onto the Research Champions Community Space. Provides a welcome and overview of what the space is about, including access to the various resources and including a code of conduct, so you know exactly what the space is for, what the forms are for, and how to use them for your benefit. As mentioned, one of the key elements of the space is the forums. There is a discussion forum set for each of the 15 CRNs, as well as a general discussion forum board as well. A code of conduct is in use when using the forms, which is included there, so people know how to use them. The forms are moderated by the NCRN Coordinating Centre. That's the centre that's based in both Leeds and London. But fundamentally offers research champions the ability to connect with each other when perhaps meetings aren't taking place or any ideas pop up, but also lets them network and discuss from further afield as well. So connect with people from other CRNs from all over the country. You can also, as part of the space, tap into some other resources such as Delve, which is the library of relevant, interesting learning materials. And you can also access a number of other resources to support your role, such as how to ask the right questions, how to develop presentation skills, or even look at how you make your decision making. So it's a great platform for research champions. The Be Part of Research website, I've mentioned this in previous slides. So the Be Part of Research website is designed to help anyone find out about health and social care research that's taking place in the UK. It allows members of the public to search for opportunities and to ask to take part in studies. The website also acts as a simple tool for busy clinicians and healthcare professionals, so they can use it to support patients who want to take part or learn more about research. The website builds upon the success of the UK Clinical Trials Gateway, which was managed by the NIHR and was operating for a number of years. As a website, it's always being developed to offer greater functionality, such as at the minute they're exploring the potential to allow patients to register an interest in certain topics or areas, and also improve the accessibility and the navigation of their website. Study data is refreshed weekly and comes directly from two databases which are the International Standards Randomized Controlled Trial Registry and also clinicaltrials.gov. Online training. So one of the key things we look at online training are massive open online courses, or MOOCs as they're called. This is a term that originated in 2008 and describes free, easily accessible, completely online courses. MOOCs give people the chance to study with top universities around the world. They don't normally do any formal qualifications, but you can gain knowledge in all sorts of areas. You might use it to develop career skills or prepare for their education or to explore new interest. There's not normally any entry requirements for these, and you can take part regardless of where you live or your financial circumstances. But because they're online, they can go to be very big, and you could find yourself on a course with thousands of other people. How do they work? Well, they have a specific start and finish date, and they run a couple of times a year, and that's for a couple of weeks rather than months or years like traditional university courses do. During that time and during that course, you'll use a range of online media and interactive tools to engage and interact with educators and the learners. This might include video lectures, articles, discussions, assignments. Currently, there are 3 MOOCs that are relevant to research champions, and they've enjoyed taking part. That is, what is research? And what that does is it helps you discover how research is improving healthcare, find out what's involved in health research, busts common myths surrounding health research, and explores ways to get involved. Again, it runs for several times a year and lasts for 3 weeks. You have the COVID-19 Understanding Research During the Pandemic, again, another popular online course, and that helps you discover how scientists responded to the pandemic and how they conduct innovative research to develop treatments and vaccines. And then finally, improving healthcare through clinical research. And this covers how treatments and cures are discovered, the impact of clinical research, how we undertake clinical research, and why we do clinical research. So before moving on to the Prez, do we have any further questions relating to research champions? I know obviously we've had a question opportunity in the middle. I've gone through some more information just there. So any other questions that have come through or anyone wants to raise now?
There aren't any in the chat. Does anybody want to ask any other question? No, all good? Excellent.
Take silence as a good thing. So, Patient in Research Experience Survey, or PRES for short. What is PRES? Well, PRES is the annual national standardized survey used to collect adult and children's views of experiences of participating in NIHR supported research. PRES was developed by the NIHR Clinical Research Network to demonstrate to research participants that their contribution is valued and to help make meaningful improvements to research based on people's real life experiences. It's the largest survey of its kind and up to 15 clinical research networks across England support it and take part in it. So research is a partnership between people who volunteer to take part as participants and the researchers. And every year the NIHR asks thousands of people and participants to give their feedback on their experiences to help improve the way research studies are designed and delivered for now, live, and in the future, so that we can positively impact people's experiences, recruitment to, and take part in research. So as you can see there, the PRES forms a really critical part of any of that sort of that research cycle, so people continually are able to improve their studies. In 2020-21, over 20,000 participants completed the PRES. So let's look at the value of the PRES in a bit more detail. So asking people what could be done better, we can get a wide range of answers, from further information on the outcome of a piece of research someone's been involved in, right down to being offered a cup of tea. But even these smaller or softer aspects, the cup of tea or biscuit, have an impact on someone's view of a study. Retention of participants on studies. If you're able to offer someone a way to communicate, make them feel listened to, they're more likely to continue in a study. Promotion of the study or research by participants. If people are feeling valued and listened to, they will help you promote that study or research. Repeat with customers. Yep, happy customers are repeat customers. That's pretty straightforward. Feeding information back to chief investigators for the next study or to change this one. The PRES can help studies respond to issues flagged up by participants and allow you to put these right. That could be live within a study that's active or thinking about your next study. Carrying on, the PRES can provide real-time feedback to local research teams to help improve services for current and future patients. Depending on the study, researchers can get real-time feedback, allowing them to respond quickly to issues, understand what aspects they're doing well. This positive feedback to staff can show real appreciation for the time and effort they're putting in. And the PRES also offers the ability to look at common themes nationally and regionally, allowing for new initiatives and supports to be designed for participants. As previously mentioned, the PRES canvasses both adults, children and young people. To help accessibility, we have 4 surveys which use slightly different language and terminology, as well as OK to say no. Regarding the 4 PRES surveys, it's expected that 0 to 6 surveys completed by a parent or guardian on behalf of that participant or that child with their input. The 7 to 11 surveys completed in partnership with that parent or guardian, and the 12 to 15 adult are completed independently. The OK to say no survey is an opportunity to capture why someone has declined to take part in a study and can really help a researcher better understand why that person has declined to participate. It could be something as simple as they didn't have time, or they're running out, or that their parking was running out, or it might be something as simple as they didn't feel it was the right arena or place to have that discussion. This can allow researchers to mitigate against certain issues in the future. If they're not feeling comfortable to talk, they can maybe have a room set up where they can maybe recruit or talk to people. The survey is only 1 question long, but can really help researchers avoid issues that could stop someone from participating in the future. How to access the PRES? The PRES for our NCRN is completely digital and can be accessed for both researchers and participants from the website myresearchexperience.com. If you're a researcher, you can get further information via a video on the website, which provides guidance on how to either log in or register, and how to create and provide access for a survey for participants. There are 3 ways to access the survey on the website. You can access it via launch directly from a device, smartphone, computer, tablet, often provided by the study, perhaps on the premises, maybe at a visit. An email code can be sent to participants, linking them to the site of the appropriate survey. This can be done individually or in a bulk email to all participants. Or you can give them a card with a code which allows them access to the PRES at a later date. So as you can see, here's a typical PRES card we handed out to participants. As you see, it highlights the website and how to access the survey using a unique code. So one of the main benefits of a digital PRES is the ability to see feedback live. And this is obviously much more responsive than, say, over a written response. Data is captured and updated overnight, allowing for quick responses. and comments are available individually and feedback available individually to each trust, so they can actually delve into some of the issues or comments that have come through from participants. So that's a real strong point for having the PRES digital. So thinking about, and it's worth finishing off with some of the opportunities PRES can offer. So you can help gain information at the pilot stage before launch of the main study, helping you make sure that study is fit for purpose and you can mitigate against any issues. It can help convince ethics and R&D of acceptability of a study design or approach, again, reflecting on feedback. It can be used to help failing studies. If you know why a study is failing, you can respond and hopefully save that study or make note of those failures for future studies so we can avoid them. It can be part of the research outcomes and papers, providing feedback and information, and it can inform design of future studies. Again, as previously mentioned, avoiding maybe some of the pitfalls failing studies have had. So that was a bit of a whistle-top tour through PRES. Does anyone have any questions regarding PRES as a system and program and process? Great. Well, since there's no more questions, this is the final slide here. So you want to find out more on this when this presentation is available. You can click on these links to find out more about the PRES, which will link you to that website, which has a bit of a video on what the PRES is about and how to access it. And if you want to find out more about the research champions, again, that link will take you to that page on our website. Or if you do want to get in touch around the PRES or research champions or anything more, my email address is on the bottom there. Very simple, dan.duran@nihr.ac.uk.